Yeah, I can remember learning about the oral manifestations of HIV in oral medicine, and then how that was linked into the communication skills, so that dentists would feel able to discuss confidently with patients if they had anything that they thought might need further exploration, really, and to ask the right questions. And we were always taught to treat everybody the same, even, whether or not we knew their HIV status, and that was really important as well. I think, first of all, I was during undergraduate. I think the communication skills enabled me to see just a low level of knowledge amongst other people that I was learning with, actually, and how much education was still needed around HIV. So, and then going into practice, I remember having a patient who was HIV positive, and it was known, and then my nurse started to act differently when she was setting the bay up, and we had to have a long conversation about how we never knew that the patient before us, wasn't HIV positive, and so it was interesting in terms of the patients who we know are HIV and the kind of stigma that they might face, and also the way that we're really keen not to pass on HIV and that cross-infection control. So it's kind of double-edged, really, isn't it? There's two reasons why it's really important, I suppose, that people start to feel comfortable with that, because they need to educate people as healthcare professionals, especially most dentists kind of should lead the team, really. Yeah. And so that's important, that element of education, but also, yeah, the cross-infection control is really important as well. I think it's for two reasons. I think it's so that everybody gets treated the same in that interpersonal sense, but also so that we make sure that we don't make any assumptions that we can, it doesn't matter if we don't sterilise that instrument, they looked okay, and yeah. So it's important in terms of how we make people living with HIV feel, and also about how we prevent HIV from spreading, really. So it's those two things that are really, really key. I think very early on, if I'm honest, people were asking, do we need to treat people who are HIV positive? I think it was that basic a level, and I do think there were comments, I'm not sure I would, and I was quite shocked by that, really, very early on in the programme. Yeah. And then you realise that most people have never been faced with somebody that they know is HIV positive. And I think it's always about stereotypes, isn't it? Yeah. That's always the key thing, that we kind of, and I think we probably all, if somebody mentions somebody living with HIV to me, I probably have a stereotype that is, maybe people that I've known myself, and I think it's just, so the really important bit is I think looking at the demographics is important, so people can get a picture of just how many people who, from all different demographics, might be living with HIV now. Having pictures of people who you wouldn't necessarily expect to be HIV positive is good. So they're kind of maybe middle-aged, middle-class white person. That's not often what people, a woman in particular, that's not often what people imagine to be as someone who's living with HIV, and people can contract it through all sorts of different ways. There are lots of people who contract HIV through their partners as well, so talking about routes of transmission and how often that happens is really, really important. But also it's important not to then say, that you blame them and not that. Blame is a really, really important issue here. So just as if a young gay man contracts HIV through having unprotected sex, you don't want to be saying, they're worse than the person who, because everybody's got different reasons for having sex, haven't they? And that's really important. And I think it's important that we remember that a lot of people who start dentistry and getting asked to discuss this, they often won't be sexually active themselves. Sure. And they might come from cultures where it's more likely that they will just have one sexual partner, and that's what they'll be encouraged with. But that you'll have a huge spectrum on that, won't you? I think there were cultural barriers to us discussing it at undergraduate level that weren't necessarily present elsewhere that I went. And I think that's just, again, reflects the huge difference in the way that different cultures live and things. And But what you always learn is that it's happening everywhere. It's just whether it's open or not. I think having lived examples of people and being able to talk about what we do ourselves, you know. So I think that's really, like, I think it helped that I was a 30-year-old gay man when I started dental school, dealing with people who said they'd never met a gay person before, and I said, of course you have. They just haven't discussed it with you. So I think everybody leading by example, and then similarly, if people don't feel that we should be sexually active before marriage, for them to be able to say that as well. That was also everybody being able to respect other people's views, and I mean that's the hardest thing, isn't it? But I think that kind of open communication is absolutely key.